Good afternoon. My name is Dr. Dora Clayton-Jones, and I am an educator. I am a pediatric nurse practitioner by profession, and most importantly, I'm a parent. And during this time where there is a great deal of media coverage covering coronavirus, COVID-19, I am really concerned about our children and what information they are receiving and how they're processing it. And so this message is for parents who have children like me. My children are older, they're teen and young adult, but I am, children are near and dear to my heart. And so I don't want us to forget about children during this period. So I encourage adults to continue to read trusted information, review trusted information. The Centers for Disease Control and Intervention, or CDC.gov, is a trusted website, and so you can rely on that website for information. Kidshealth.org also has some information about talking to your children about what they may see and hear in the media, as well as some information about talking to your children about coronavirus. And then I will just really highlight some things. Again, this is really for parents and directing conversations to your children. And so what is really important is for you to first understand where you are with regards to this. What information do you know? What information do you need to know? And how will you obtain that information? Again, make sure that you are using reliable sources. So cdc.gov, that's www.cdc.gov, and also kidshealth.org are trusted resources that you can use in terms of online resources. So, be familiar with, what coronavirus is. Make sure that we are not, relaying misinformation, incomplete information to others and to our children. So first, let's assess where we are. Then we want to assess where our children are. They may bring it up. Because it is so widespreadly covered in the media that the children may bring it up and they may ask, well, what is it? So we don't want to skirt around that. We don't want to avoid answering their questions. What we want to do is say, ask them the question, well, what do you know about it? Assess what they know. And they may know a great deal about it. They may have some misinformation. So assess what they know so that we can best address their needs. And after asking them, what do you know about it? Ask them, how do they feel about it? They could be scared. They could be, it could be very frightening for them. They could be, just confused. Ask them how they feel about it, and explore their feelings and address their feelings. Acknowledge their feelings. I always say that being a preschooler, that's between the ages of 3 and 6 years of age, is usually one of the scariest times to be a child. And so there's a lot of magical thinking going on. They take things very literally. So we have to be very mindful about the language that we're using and the words that we're using. Really try to avoid saying bad virus. If you're going to talk about a virus, usually for school age and up, school age to teens and up. And but for younger children, we can just talk about it as, it's something that can cause someone to feel sick, not feel well. When we start talking about bugs and virus, again, 3 to 6 years of age is a very scary time. And so using those words can be frightening for children. So, be sure to assess and explore where your children are. We want to limit exposure to scary news. There's a lot of things that will be popping up on the television, and so you want to be mindful of that exposure that children are getting through the news coverage. So we don't want to leave the television on and leave our children in the room for them to just hear any news that may come up, news flash that may come up about coronavirus, because there are updates that are going on all day long, 24/7. And so limit exposure to scary news so that we don't make this, we can make this as less frightening as possible and support our children. And in addition to, talking with our children, assessing where they are, assessing how they feel about this, we can help them to work through their emotions and process this by drawing, engaging in play, maybe some art, writing about it as well, maybe journaling. So, finding that activity that is a fit for your child based on their age, but engaging them in activities and, doing it with them rather than leaving them, kind of at the table doing it themselves. And so when time allows, try to engage in that activity with them. We want to continue to encourage good hygiene. We've been instructed, we're receiving instructions on how to do that. I'm not going to reiterate that or repeat that because we have enough resources, but make sure that they engage in good hygiene as well. Make hand washing into a game. If they can sing the ABCs, they've washed their hands for the minimum of 20 seconds, or more by singing the ABCs. So sing the ABCs a couple times, make it fun, make it into a game, so let's see who can wash their hands the longest. So, and do it with them. We want to support them in their understanding. So when we're washing our hands with them, that helps. And we want to discuss ways to help others and act. For our school-age children who really get a sense of accomplishment by doing, by identifying ways to help others, maybe there is a food drive, maybe there is a supply drive, maybe there are some other activities that are going on in our communities that we can do. And I'm sure there will be more things that will be forthcoming. But when we as things unfold, consider ways to support our most, our people, communities, children that need it the most. And so sharing information like this or similar is one place to start. Thank you so much for listening. And, for the sake of all children, thank you for sharing this information.